It's time for another new Kansas City Spotlight. Here's your host, Belinda Post.
We have explored treating depression without medication through TMS therapy, but now Dr. Sunny Elliott of Sunrise Psychiatry shares how it's helping people regain control of their thoughts and say goodbye to OCD behaviors. Now, you recently started using TMS therapy for OCD. Can you tell me a little bit about that?
Yes, so OCD, most people are aware that stands for obsessive compulsive disorder. Encompasses a range of symptoms. Some people struggle with excessive, obsessive thoughts about certain ideals or behaviors or belief systems. The key part of it is that it's taking up so much of their time or so intrusive in their lives. Although they know that it's something that they don't want to be thinking about, they're unable to stop the process. Some people that have OCD will also then have compulsive behaviors. It's not always a part of the overall OCD process. And that can be a mental compulsion, but it also sometimes can be a physical compulsion. So most people in society are familiar with like people that struggle with excessive hand washing, for example, or people that struggle with obsessive cleaning patterns. Although it's not very, very common in society, it is pretty devastating of a process. And typically, historically, has been treated primarily with extensive psychotherapy and some medications. But medications don't work as well for OCD. It's a pretty difficult condition to find relief. So fortunately, TMS has been an option that gives people another additional way to try to find some relief.
What does that take in terms of time when you're treating for depression versus treating for OCD?
That's a great question. So we have talked a lot about TMS and its utility for treating major depressive disorder and generalized anxiety disorder, which is, treatment for worried wills. Typically, that treatment takes overall 9 weeks. The OCD treatment is a lot fewer treatments, where it's a total of 26 treatments without any kind of titration. So people will come in every single day until they get to treatment 26 and then be done.
Well, Dr. Sunny Elliott, thank you so much for explaining that for us and also for bringing this means of wellness to the Kansas City area.
Absolutely. If anyone has any questions, give our office a call.